I wanted to talk about an issue that is surfacing, especially as we approach the school year, a topic that we talked about a great deal. And as we've all heard me say many times, my number one job as the governor is to keep New Yorkers safe. That's why today I'll be giving an update on our vaccination efforts against COVID-19. Now, I want to be very clear. This is not going back to the dark, scary days of 2020, 2021, and 2022. We are far from it. And we have excellent vaccines, including an updated vaccine just approved by the federal government. Now, cases and hospitalizations are not elevated from what they had been this summer. They're actually down a little bit from recent weeks. And we're continuing our surveillance. People ask how you're doing your surveillance. It's statewide wastewater surveillance. It also allows us to see whether there's any spikes in particular communities. And it indicates right now that cases are down from what we had seen in the summertime. You can see over there, they spiked up a little bit over the summer, and now they're starting to trend down. Now that is the good news. But we have a history now. The weather changes. People start going back indoors. Kids are back in school, and they're all spreading a lot of germs. And we do tend to see, when the weather changes, a seasonal uptick in illnesses like flu and COVID-19. Now, they spread once it gets cold outside. People spend more time, and especially around the holidays. So the data is clear. The vaccines actually work, and it reduces infections by 57% in 18 to 49-year-olds. And it cuts doctor visits and hospital visits down by about 50%. That's all good news. Now, here's the choice people have, New Yorkers. I know you don't want to hear about this, but you can spend Thanksgiving quarantining, walking around the house with a mask on, not enjoying the holiday dinner, waiting for a nasal swab from a hospital, or you can be with your family. I want to encourage all New Yorkers, now is the time to take care of yourselves and your children. Don't wait till later. Don't get sick. There have been cases around even my office where people got sick over the summer, and it is long in duration and is really unpleasant. So all of that is avoidable, which is extraordinary. And the good news is these new federal vaccines, federally approved vaccines, are available at your pharmacy right now. And the home test kits are available. The COVID test swabs are going to be available again by mail. So people should take advantage of that. That's coming from the federal government. So in order to make sure we're doing this properly, in a couple minutes you'll see Dr. McDonald be signing another version of our standing order to make sure people can get a shot at their local pharmacies without a prescription. Again, we had to do that by an executive order, which you'll be seeing shortly. So we want this to be easy, hassle-free. Most insurance will cover the cost of the shots. And for those who are uninsured, your insurance won't cover this. We have shots for free at community health centers all over New York or our local health departments. And we'll make sure that that information gets out there. So just so you know, I went first. I got my COVID shot yesterday. I'm fine, don't feel anything. And it's highly recommended for anyone 6 months or older. I know my little 2-year-old granddaughter, I think, got one this week. My family has gotten it. So this is a family outing. Bring everybody. And again, the beginning of this season is the best time to protect you, to get your flu, your RSV, your COVID vaccines. And there's no reason to make multiple trips, just do it all in one shot. So to give more details, I'll turn it over to our health commissioner, Dr. McDonald. But before that, you can see a quick video. In case you don't believe me, I did get the shot yesterday. Hi everyone, Kathy Hochul is reminding everyone it's time to get that COVID shot. I know a lot of us want to forget about COVID, but we all know somebody who's contracted it and not feeling good these days, so here's how we can prevent it. Just stop by your local drugstore, your pharmacy, your own provider. Get the shot now. Every year you should be thinking about getting that. It doesn't take any time at all. In fact, we're going to show you how fast. Let's time my visit here today. Let's get started. Oh, yes.
Nice to meet you.
Nice to see you. Hi.
Welcome in, Governor. How are you?
Nice to see you.
Great to see you as well. Welcome in.
Thank you.
Here for your vaccine today?
Yes, I am.
I'm just glad you guys. Thank you, man. You'll just see a pharmacist Danielle in here. She'll help you around here.
All right. Thank you.
Hi, Governor Hochul. My name is Danielle.
Hi, Danielle. How are you?
I'm good, thank you. How are you?
Doing a lot of these or not so many?
Oh, yeah, we're doing plenty, which is great because we want to protect our community.
Yes, we do. Yes, we do. All right. Word of advice to everybody, wear the right clothing. It's going to go up really high on the arm.
All righty, Governor?
All right, here we go. 3, 2, 1.
3, 2,
right, tell me when you're gonna start. Didn't even feel it. Okay, that took 3 minutes and 14 seconds. Thanks, everybody. Appreciate it.
so much.
Thank you.
Thank you.
All right, quick and painless. That's the message from your governor. Everybody get out there and do it. Dr. McDonald, let's hear from you.
Yeah, thank you, Governor, and good afternoon, everybody. Good to be here with you today. Yeah, you know, it's interesting, as summer comes to a close and our minds go more towards pumpkin spice and back to school and all the things that go with fall, you know, I think we also remember it's the time of the year where people do get sick, right? Flu season is part of our winter tradition. One way to really prevent a winter tradition where you're all sick is to look at the vaccines that are out there, right? So the governor talked a little bit about the new COVID vaccine. You know, the COVID vaccine by Moderna and Pfizer. It's well matched to the circulating variant. We've been living with the Omicron variant for quite some time, and the subvariants have really been, you know, all over the place. But right now, the dominant subvariant is KP2, which is the same one that's in the Moderna and Pfizer vaccine. So the vaccine looks well matched. You know, Novavax just had their vaccine recently approved as well, which protects against another variant, JN1. Yes, the alphabet soup of subvariants continues, but I think the important thing is get a vaccine, you know, and everyone really should be getting a vaccine. It's the 65 and older crowd that's higher risk, more important for them in particular. You know, if people ask, why did I do a standing order last year? It was simply because I was asked to. We heard there's some gaps, and so we did a standing order. We updating it this year just to make sure everybody who wants a COVID vaccine can get a COVID vaccine. I highly recommend people do that. You know, as the governor said, it's a safe and effective vaccine. I want to just highlight some of the things the vaccine prevents. It does prevent illness in a little over half the people based on last year's data. There was a study published in New England Journal of Medicine in July, though, that looked at how did this affect long COVID. And when you looked at the Omicron subvariant, 55% reduction in people getting long COVID. So long COVID is something that concerns me as a state health commissioner. It's one more reason to get the vaccine. The vaccine was shown in a CDC publication earlier this year, last year's vaccine, over 50% reduction in people ending up in a hospital. And there's several studies that show the vaccine effectiveness was over 70% in preventing death. So it's a safe and effective vaccine. I think it's important just to have some context too, right? Like the governor said, we're nowhere near where we were when COVID was at its peak. But I do think we need to look at what happened in the last 12 months. I hope we aren't used to it, right? There was 3,500 New Yorkers who passed away related to COVID last year. I don't ever want to get used to that. There was a little over 73,000 New Yorkers who had a COVID-related hospitalization. And our vaccine numbers at a little over 12% really aren't that high. And I think we need to look in the mirror and say, regardless of what we've heard or what we've thought, if you haven't thought about a COVID vaccine recently, I highly encourage people to do that. I'm your state's doctor. I'm interested in protecting you. There's 20 million of you. I worry about some of you more than others. But when I get a chance to share my advice with you, I would like to, which is I highly recommend you look at that COVID vaccine. Thank you so much.
All right. Commissioner McDonald, let's sign the standing order.
Stills down.
All right. All right. The order is passed. You can get these available at your pharmacy without a prescription. That's what this is all about. All right. Thank you, Dr. McDonald. Join me. We'll take a few questions.
So I know we have a lot of interest in a bunch of things. We're going to start with on-topic questions about public health or health care in general. Bueller? Yeah, in the back here.
Governor, we've been doing the back-to-school stories now for 2 weeks. I think the principal concern that we hear from parents and over is classroom size, curriculum, other things. What we do not hear is getting my kid a COVID shot. You know, I'm a journalist, I'm a New Yorker, so I'm skeptical by nature, double dose. So my question to you is, you know, how necessary is this reminder and this standing order when it doesn't seem to be a principal concern of parents?
Every parent should be aware that they can do more to protect their child from developing an illness that can set them back. They can end up missing school for a week. They'll be isolated from their friends. We don't know about long COVID in children, but as a parent myself and a grandparent, I said, get them the second they're available. This is how you protect your kids. And I would hope parents who are now thinking that COVID is over will pay attention to the media coverage coming out of today and say it's not over, but take one more step to protect your loved one. That's all we're talking about.
I think your question is exactly why this is such an important issue, though, quite frankly. I mean, I think one of the things that I think as a pediatrician, not just a parent, you know, yes, kids generally do well, but it stinks to have COVID. As somebody who's had it myself, it's miserable. So it's a great time to prevent that.
Politico reported last week on a higher than expected increase in emergency medical visits. We're seeing average wait times in ERs of 26 hours per state data for a bed due to limited capacity at hospitals. Are you concerned? Are you following this? And are you planning to do anything?
Yeah, so I'm concerned about this. I think one of the things you see is we have a healthcare worker shortage in New York. It's no secret. There's a lot of things we're doing in the 1115 waiver through the workforce innovation organizations, the three, to really bring more people into healthcare and to help more people have an interest, not just in healthcare, but succeeding as nurses and doctors. There's other things we're doing in the diversity in medicine program to get more people into healthcare who are coming from underrepresented communities. One of the things we need to look at, though, is it would be really swell if the legislature would come alongside us and help us with expanding scope of practice in New York. We're the only state in the country that doesn't have a medical system give a vaccine. There's 41 states that thought a nurse licensure compact was a great idea. New York hasn't signed up yet. We've asked nicely. There's 40 states who have the interstate physician licensure compact. New York isn't one of them yet. When you look at nursing homes, what the nursing homes are telling me, they'd like certified medication aides to be able to give medicine like occurs in 37 other states. We really need to look at some of the things that have worked in other states because it's a healthcare workforce issue. What you're seeing, Maya, is a symptom of a disease. And the disease is we need to have more healthcare workers, but we need that the healthcare workers we have practice to the skills they were trained to do.
And I think that's an excellent point. Just for further clarification, those determinations on adding more facilities to what a healthcare worker can do, more within their job description or even adding more different categories, is currently residing now in the Department of Education, not the Department of Health. We raised this last year as an area we'd like to see a change because I trust Dr. McDonald to understand the scale that you're talking about here because this is what his responsibility is. So it's something we can talk to the legislature once again as they see the data that shows we do have a healthcare crisis. The 1115 waiver he referenced, we just announced with SEIU last week or so, about $650 million will be allocated to improve education and take people from entry-level healthcare positions up through the ranks and get more professionals skilled to do these jobs. But I also do believe that there are activities like administration of a vaccine, which could be done with someone with less credentials as they are in other states. We're just asking for some parity with what other states are doing to help us deal with this shortage of workers.
Last one, Vern, on topic.
And if the health commissioner could just run some numbers over, what is the current vaccination rate in New York City compared to the rest of the state, and how does that compare, I guess, to last year?
Yeah, so the vaccine just came out, so I can't give you numbers on what's happening right now, which I know.
Not with the new
Right.
vaccine, but what is the current rate?
It's about 12%, and that's low. You know, when you look at nursing homes, we got to as high as 40%, and that's low. You know, I think one of the things we're seeing is the pandemic was a population trauma for everyone. Everyone had a hard time with this. I think there's nothing wrong with owning that and, quite frankly, saying, how do we move forward? As your doctor, what I'm trying to do is help you stay well, keep you out of a hospital, have you, quite frankly, risk less and live well. You know, the vaccine is the best thing I have to protect you from ending up in a hospital or worse, and also protecting you against long COVID. And I think this is one of those things where put your politics aside, look at your personal health. If you have a question, ask your doctor, ask your Department of Health, ask your local health department. We have objective, honest information. We're happy to answer questions for you, but it's in your best interest to get the vaccine.
Why do you think people have stopped getting the vaccine or stopped getting boosted?
I think there's a lot of reasons. One of the biggest reasons, though, is I don't think people think it's a serious disease. But quite frankly, I think this is sort of the trauma. We somehow became used to 3,500 plus deaths in New York. I'm not comfortable getting used to that. We somehow got used to over 73,000 people ending up in a hospital from COVID. I don't ever want to be used to that. And I think you think that people just don't think it's that severe disease. The other thing that I think people don't, it wasn't developed the same way as every other vaccine was. That's just a lie. It was developed the same way every other vaccine was developed. It's approved by the same Food and Drug Administration that approves every other vaccine. Goes through the same rigorous process. And it's been out since 2020 now. You know, December 14th, 2020 was our first vaccine of the COVID vaccine. I think we know what this is, you know, and yes, the vaccine's updated. It's not a booster, it's an updated vaccine. The virus changed, the vaccine has to change to keep up with it. We are fortunate right now to have a well-matched vaccine, so I highly encourage folks to take advantage of that.
All right, is this on topic about public health? All right, we're going to excuse Dr. McDonald. We'll be back in a second for anything else that might be interesting to you guys.